This next technique is a self-massage technique for the sternocleidomastoid muscle, also known as the SCM. Let me grab my assistant Gustav here. And the SCM attaches here at the mastoid process and then at the sternum and the clavicle, hence its name. So what we're going to do for this technique is we're going to grab our digits and we're just gently going to pinch the muscle as close as we can get to the top, and we're slowly going to work our way down, hanging out at some of the spots that feel more relevant. There's two ways of doing the SCM self-massage. The first way I'm going to demonstrate is with liquid chalk, which is my preferred way. And so I'm just going to put just a tiny little droplet there. I'm going to rub it between my hands. And what that does is it prevents any glide. It's really important that we don't have glide with this muscle. We want to have a nice, sturdy, static hold. So I'm going to be pinching the muscle. So I'm going to start up here at just below the ear at the mastoid process. So nice and neutral. I'm looking straight ahead. My thumb is at the front of the muscle, and then my two other digits are just grasping it in the back, and I'm just doing a very, very mild pinch. And if you're having trouble locating this, sometimes adding a little bit of tilt, there we go, that gives me a nice grip there, and that is feeling particularly relevant for me. It doesn't take a lot of pressure in order to have an effect on this muscle. So I would suggest just finding a spot that feels tight, tender, and relevant and hanging out there for as long as feels comfortable for you. Sometimes application of pressure to this muscle can cause referred pain or sensations, which is totally normal. As long as it doesn't hurt you, I would encourage you to hang out there until that changes. Then you can slowly start, so I'm going back to neutral here. You're slowly going to start working your way down. So back to neutral. My thumb is at the front of the muscle here, and then my second and third finger is grasping this really meaty muscle, and I'm just applying a very mild pressure. So I'm approximating my thumb and fingers here, and just a little bit of pressure. And if you want, you can tilt towards that side if you have difficulty of access, or if you just want to deepen the technique. And you can go all the way down up to the sternum. So if something feels relevant, tight, hang out there. There's no rush when it comes to this tissue here. So this particular area for myself feels like it needs a little bit of attention, especially the back fingers there. And then you can work your way to, and this one I definitely need a bit of tilt on my body in order to access it. Oh man, that feels so good. Another way to self-treat this muscle is to use a Kleenex, because we really don't want any glide for this particular technique because the muscle tends to pop out underneath. So I would recommend using a tissue, and what you're going to do is, again, you're going to do that pinching technique, but you're going to do it over the Kleenex. So here I have the Kleenex, and I'm just going to put the same positions with my thumb and my two digits, and I'm just going to pinch that tissue and give it a nice treatment. So the Kleenex, again, like the liquid chalk, just prevents any glide from happening when treating the sternocleidomastoid muscle. Do not need a lot of pressure for this particular treatment. I would encourage you to do this once, maybe twice a week for a few minutes. Also of import, make sure you do both sides. Remember, respect the injury, be patient with the process, but most of all, be gentle with yourself.